Welcome, everyone. Thank you so much for attending today's safety training for Q4. We have two great presentations ready for you for today. For just a quick overview of a few things before we get started, if you are here to get 2 safety credits for the 2023 year, make sure to put your policy name and who is attending, as well as the email for that person that's attending, in the chat for me so I can make sure to accurately credit those credits where they are due. And then if you have any questions throughout the presentations today, don't hesitate to put those in the chat function or the Q&A function at the bottom of your screen. Both presenters will be answering those questions throughout their presentations. So we look forward to having both those presentations here in just a minute. The first presentation today is by Brandi Janssen, and she is presenting on preventing needlestick injuries in livestock production. She is from a clinical associate professor in occupational and environmental health and directs Iowa's Center for Agricultural Health and Safety. Brandi, if you would like to start presentation, go ahead. Thank you so much.
All right, you should be seeing my title slide. Let me just get the chat open as well. It's good to be here with you all on this afternoon. I think our time zones are in agreement that it is afternoon. It's about 1:30 here in Iowa. It's good to be with you. Yes, so I direct Iowa Center for Agricultural Safety and Health. I am a faculty member at the University of Iowa. More importantly, though, I'm a farm kid from the Missouri Ozarks, so a lot of the work that I do, I find reflecting on my experience growing up on a cattle farm as a kid in the 80s. So today I want to talk a bit, sort of focuses definitely on needlestick injury prevention, but of course, that's all in the context of overall animal handling. So I want to talk first by just about some basic animal handling principles, best practices, things, and individuals, especially those of you out in Colorado, are probably already familiar with. I like the work of Temple Grandin a lot and the way she thinks about how we interact with food animals. Some of the risks of different injected pharmaceuticals, and then some guidelines for needlestick injury prevention and how you might think about a needlestick injury prevention program on your farm. I will say the photo there on the lower right, that's my dad and his favorite bull, who he called Biggin. As a safety and health professional now, I do not really recommend going out and currying your Hereford bull, but he liked that bull a lot, so it's a picture I always enjoy. So starting with facilities, right? Needlestick prevention starts long before you ever have to inject an animal. You have to think about how you're going to get them where you need them in a way that's safe and ideally calm, right? So I guess one advantage of safety in animal handling is that when you move slowly and deliberately, you're actually improving your end product. That sometimes it's a hard sell for farmers with equipment or other infrastructure on their farm. They're feeling like they're in a rush and they need to move quickly because they feel like they need to get the job done. And that's certainly true with livestock handling as well, but you get an extra incentive for slow, steady, and deliberate work in just improving the quality of meat or quality of milk, whatever your product is at the end of the day. So handling facilities are something to think through in the context of something as specific as needlestick injury prevention as well. Good facilities help keep those animals calm, especially for the non-routine tasks, right? Loading in, loading out, giving injections on the kill floor in a processing facility. These are not things that happen every day for animals. And so thinking about that, those unfamiliar tasks are an important piece of it. Lighting matters. A lot of ruminants tend to balk at moving into dark spaces. Horses are notorious for not wanting to walk over dark ground or a mud puddle because they can't see what's under their feet. It makes them nervous. They have a tendency to stop, back up, or balk going forward. Some kind of textured flooring reduces the possibility of slips and trips and falls. That's for both animals and people. People ask me what's the most likely way you're going to hurt yourself on your farm. It's probably you're going to fall down or fall off of something. So thinking about flooring and animal handling facilities to keep you on your feet is a good idea. Allowing space for turning, except in lanes or chutes, is helpful, and especially if that's controlled. I have a little bit of a slide about that as well. A lot of ruminants, cattle in particular, they like to turn around and go back where they came from. It makes them feel like they know what's happening because they feel like they've already been there before. So allowing that space can be helpful in keeping them calm. And then, of course, what we're talking about, all of these animals are herd animals, so they like to be able to see their buddies, and they are calmer if they can see other herd members, or at least a couple lengths ahead of them, so they kind of know what's coming. That also helps keeping them calm. And then by the time they get into the head gate or the chute, they're as calm as possible when you give an injection. So this is good design principles. This comes from the work of Temple Grandin, who I know is in your neighborhood there in Colorado. There's that 180-degree turn for cattle. This is specific to cattle, knowing that cattle like to, as I said, go back where they came from, but they don't like to get bound up in a corner. So there's these lovely, curved lanes. I also know from working with farmers over the years that a facility like this is sometimes aspirational, right? This only makes sense if you're a pretty big operation, and you can invest in it. And most of us work with what we have. This is the layout of the barn that we handled cattle where I grew up, and it was just a slat-sided building. It was really functional. It worked really well. You could isolate a calf in there when you needed to. When we occasionally kept a milk cow for our own family's use. There was a space to milk. It was just a really multifunctional barn. And there would have been no way that we would have upgraded to the level of facilities that are advocated for by by Grandin and others. It just wasn't feasible for us. But it doesn't mean we couldn't have thought through how to implement some of those principles of turning, making sure that sight lanes are animals have a couple of lengths in front of them that they can see, maybe rounding off some sharp corners, making sure they don't feel bound up. And we certainly could have done a lot of work in the head gate area. I'll talk a little bit about animal restraint and needle sticks. We just had a very basic head gate that was manually controlled, and not even with you literally reached over and pulled the head gate shut, which, as I said, looking back on that as a safety professional, was not ideal. We were all pretty lucky. Nobody got hurt, but in thinking about it, we had animals, by the time they got into the head gate, they were pretty wound up. And so it was not ideal for keeping everybody kind of calm and relaxed the way I'm describing that's what we should do when we're handling animals. So thinking more specifically about pharmaceuticals and needle sticks and prevention, vaccines are certainly the most commonly injected products from what we know. Most folks keep some sort of vaccine schedule for their herd animals. There's lots of discussion about that. I keep up with some of the talk here in Iowa, and obviously every producer kind of has their own approach to which of the schedule they think is important for their herd and which isn't. But the bottom line is most people are giving some vaccines over the course of the year. There's some injected hormones that I'll talk about, some that are of particular occupational risk. And in some cases, antibiotics. Often, of course, these are added to feed, but in some cases, they're also injected. So they can be something to be thinking about if you're trying to prevent needle stick injuries. This is just, I'm always kind of curious as to what the schedules are recommended. This one comes from Arkansas. You think about the number of injections you might be given your herd animals over the course of the year. It could be quite a few. So this is given the frequency that we provide, injected medications or vaccines, that makes the needle stick issue all the more important. But of course, your specifics of your vaccine schedules are gonna be based on your local area and what the disease burdens are there. And I imagine that Bill has a lot more local information than I do about what's typical in your area. We know that in terms of livestock-related injuries, needle sticks are one of the most common. So according to our colleagues at the University of Minnesota and the research that they've done, about 80% of farm workers have reported some sort of needle stick injury over the course of their work. And in that, vaccines are the most common drug that are involved in those needle stick injuries. And you can see from the image there, it doesn't take long. A needle used 6 times, which doesn't seem like very much if you've got a few hundred head to move through, has already been severely degraded and bent. And so you can just sort of think about how that'd feel if it went into your hand or your arm. And it's not going to be a very pleasant experience. It does not take long for those needles to get dull. We keep a few goats every year, and I figure for myself, I like about 2 uses of a needle, and then I can start feeling it more resistance than I like, and I change the needle. So thinking about that needle use is important, and recognizing that it may feel like you're being more efficient by reusing the needle multiple times, but it's going to take more effort to give the injection, and it puts you at higher risk of an infection from a dirty needle if you are stuck. So in terms of injuries that we see from needle sticks, common ones are infections. The area around the needle stick becomes infected. Sometimes that's from contamination of the needle, right? When they're used multiple times, they're contaminated with skin debris, fecal material, all the other various things that are floating around in our livestock barns. But sometimes there's an infection can occur from the product that's injected, and these change year to year, right? There's continuous improvement in biologicals that are less toxic, et cetera, but there are a number of things that could put you at risk of an infection. Erysipelas vaccines, some strains of brucellosis, Johne's disease, they can cause complications if injected into a human. So being mindful of the product that you're injecting. I'll talk a little bit about some that we pay attention to pretty closely and that are of high concern. But the infection isn't just from the needle contamination, but can also come from the product that gets injected. Inflammation. So particularly in killed vaccines and in a lot of pharmaceutical products, there's an active ingredient and there's a bunch of other stuff, right? And in particular, those vaccines that contain adjuvants, and an adjuvant is functions to enhance immune response. So, well, what does your immune response do if you get a cold or you get an injury? Your immune response, it means that all your body's going to respond to that. So, if you are injected with a product that contains some of those adjuvants, that can increase your immune response, which means the inflammation around the needle stick injury can be that much worse. So it's sort of just like chemicals and pesticide handling and every other thing. It's not always just the active ingredient that you might want to pay attention to, but what are the additional ingredients in those pharmaceuticals that might be beneficial in disease prevention, but also enhance your immune response, which means that your body is going to respond to it and you're going to feel it a lot more, right? Some other injected products that I always kind of just mentioned briefly, people, of course, there's a broader conversation about hormones and their use and in livestock production. Consumers are often worried about growth hormones from an occupational safety standpoint, just given the way these products are administered. The occupational risk is very low, right? These time-released estrogen and progestins that are used for growth production are generally not something that we worry too much about in occupational settings, because you're not too likely to accidentally inject yourself with something like this. However, those products that are being used for obstetrics are of a much higher risk, particularly for women and particularly for pregnant women. So if you're injecting anything into a mammal that is designed to affect reproduction, induce uterine contractions, or terminate pregnancy, that is certainly something that if you have a pregnant worker or you are a pregnant person, would be of high concern because of the risk of spontaneous abortion if it were accidentally injected into someone. So there's lots of hormone use, covers a lot of ground in agriculture and in livestock production. The growth hormone for occupational safety is of lower concern, but those obstetric products are of a much higher concern for those of us thinking about worker safety and animal handler safety. Other injected products that we tend to caution about, one is the brand name is Micatil, generally used to treat bovine respiratory disease. I believe there are other products available, but Micatil is sort of a one and done treatment, is my understanding. So if you go with a substitution, you may have to treat more often. The problem with the Micatil is just it is highly, highly toxic to humans. We had a death here in Iowa just a couple years ago. Somebody was administering Micatil and he put a syringe in his pocket and then he got kicked and he got a needle stick injury in the leg. He felt sort of tired and he went and sat in his truck to rest and he had a heart attack and he didn't make it. So it was a fatality. The most recent, the product is still on the market. They have changed their packaging in the last year. There's kind of ongoing guidance from federal agencies about use of Micatil and cautions around Micatil. It's a rare instance that individuals are fatally injected, but it is a risk. So it's something that we always highlight as a product to be particularly cautious when handling. Other antibiotics that are used for treatment, penicillins, tetracyclines, these may cause an allergic reaction. For people who might be allergic to them, they don't tend to rise to the level of concern as a product like Micatil does, though. So prevention, and a lot of these resources, again, come from our colleagues up at the University of Minnesota, the Upper Midwest Agricultural Safety and Health Center. They have the image here on the slide is of a poster that you can download from their website. I think they also have some in Spanish, which gives some good guidance about needle stick prevention. So I like to highlight their materials because they're concise and they're useful, and they do good work up there in Minnesota. So a lot of the prevention strategies are about how we work, right? It's about how you interact with animals. It's about your speed and your technique. But key tips for prevention, animal restraint. I'll talk a little bit more about what that looks like in a minute. You all know this. I see a lot of cattle farmers popping up there. So you're not unfamiliar with these systems. Slowing down, taking your time. Again, that's beneficial on all levels, even though you feel like you want to get the job done, taking your time and doing it. The next two, well, don't put your syringes in your pocket. It's an easy thing to do. Not your back pocket or your front pocket or your chest pocket. I would say not any of the pockets. Don't put your syringes in there if you can avoid it. The next recommendations often sort of get raised eyebrows, particularly from vets. And this is, I often hear some back and forth about this as to whether or not you should recap the needle. Generally the occupational safety recommendation is don't, because it puts you at risk of sticking yourself in your hand as you're trying to get that cap back on. On the other hand, if you have to put the needle down, I can imagine that it would make sense to put the cap back on the needle. We ask that you don't hold the cap in your mouth when you do it, though. That's generally a best practice. Often, I've given this talk in front of veterinarians before, and a lot of them look very guilty when I say maybe don't hold your cap in your mouth when you recap the needle if you're going to do that, and they all look a little sheepish. So I know that's when you've got only two hands and probably something to hold on to that you need to hold on to. I can imagine that it's of course feels like a convenience to hold the cap in your teeth, but we don't recommend it. As needles get bent or dull, discard them. They're not that expensive. Get rid of them and move on. And use a sharps container. This is something I can tell you we never had on our farm when I was growing up. And this handy one here that's official, and it's yellow and orange and with the top, and the top has a turning, you can get these at any supply store, but it does not actually have to be fancy. So this is what we keep in our barn. It's gross and I couldn't get a very clean picture of it, but an old laundry jug actually works really well. It's hard-sided, it has a lid. I took the extra step of writing that there are sharps in there because I don't generally keep my laundry detergent in the barn, but there is that one jug out there. And then this, when the whole jug is full, you dispose of the entire thing in the trash, so that hard-sided container keeps anybody handling trash safe from a needle stick. So this will last me for quite a while. It doesn't have to be fancy, as I said, just something hard-sided with a lid that you label and drop all your needles in there as you wrap up with them, as you finish up with them. So thinking about prevention from an animal restraint standpoint, again, we know every farm looks a little different. We all have different sort of resources to expend on animal handling facilities. Sometimes you have to do it out in pasture. Sometimes you can bring animals in to a central handling facility. Everybody's a little different. A head gate's a pretty basic tool. When I see this, I think, is that adequate? Not really. There's a lot of head movement there that can happen. And if she throws her head up or down while you're trying to give an injection, you may wind up with a needle in your hand instead of where you want it in her. So certainly squeeze chutes, particularly I like the ones with the, have the extra, all sorts of whiz bang extras on them, right? Controlling the animal's head, control sometimes up and down, but also side to side, so you can access an injection site. And be safe while doing it. I'm just looking at Mary's question in the Q&A. Is there a mandate for animal needles and syringes to be incinerated? The Sharps people were trying to tell me they were mandatory for humans, so infer that it would be the same for livestock. That's a great question. I would guess that that is going to vary based on sort of your local ordinances. I would call your landfill, and if there's a hazardous waste receiving entity, they could probably answer that question. I don't know that livestock, needles for use in livestock, I don't know if they have to conform to human standards. That's a good question. Thanks, Mary. Oops. Syringe design is another thing to think through. I like this picture. I sort of inherited this picture from a professor of mine here at the University of Iowa, who's also a veterinarian and an ag safety advocate. I have a feeling it's probably photoshopped, but it sort of makes me chuckle because I hope that guy's pretty quick when he gets done poking that steer with that long stick. He's going to move pretty fast. So you might think maybe distance would help you out in injection and keeping you safe, but that is probably not a great strategy. So most, particularly vaccines that are often a subcutaneous injection right under the skin. What's the hazard here? Well, you can see it, right? As you have to tent that skin to get a needle under there. The risk is it's going to come all the way through and get into your fingers. And I know it's not hard to get that needle through 2 layers of skin, even though you only want to go through one of that tent. It's not surprising that needle stick injuries are very common, given the kind of basic technique that you almost always have to use to inject something. And they just don't stay still like you want them to when you're trying to do that. The tenting of the skin, on the neck usually, or under the front leg, often for sheep or goats, they got a little bit of extra there that you can get a hold of and tent that skin up so you can get a needle just under the skin, but not into the muscle tissue. That's the goal, right, with a subcutaneous injection. But even with both of these, I can see potential, right, for a needle stick all the way through and into the person's left hand as they give the injection with their right, if the animal moves, backs up, or isn't as still as you want them to be, or are able to restrain them. There are some products, and this also may be something Bill knows from his work, that where syringes are designed so that maybe you don't have to use the two-handed technique. This photo comes from an operation in Australia, and basically the needle that is used there is just the right length, particularly for a wool animal, so it is specific to sheep, to go through that layer of wool and under the skin, but not into the muscle. And that allows the handler to give the subcutaneous injection with just one hand rather than having to use that second hand to tent the skin. So if there's a syringe that you can use with a one-handed technique, that keeps your left hand out of harm's way and out of the way of the needle as you tent the skin. Other products, and this is at least around here in Iowa, I don't hear too much about folks using these. I haven't gotten any product reviews, I would say, from the farmers that I've worked with or the vets that I've worked with. But maybe some of you have used some of these self-tenting needles. So you can kind of see there's essentially a cover over the needle with little barbs, almost like barbed wire, that's not what I'm trying to say, Velcro is what I'm trying to say. And that grabs the hide of the animal and pulls it up and creates that tent so your hand doesn't have to do it. And then the needle, which is retractable, when you inject, the needle comes forward and gives the subcutaneous injection. Like I say, I can't, I wish I could give you a true product review of this. I haven't used them, and I haven't talked to many folks around here, at least in our area, who have. Maybe some of you have, and you like this system. It does certainly have some benefits of getting your hand out of the way and reducing the possibility of an injection into your left hand as you're trying to do a two-handed injection. So in the safety and health world, we talk about the hierarchy of controls. So when you think about, okay, here's the process that I need to accomplish, and there might be a number of hazards that go along with it. Of course, with vaccines, it's needle sticks. That's the focus of this talk today, but also all those other issues of being injured by the animal, being caught between the animal and a fence or a wall, falling, etc. So when we think about the hierarchy of controls, we think, okay, so how can we change our systems so that we reduce the hazard and we reduce the person's or the workers' interaction with that hazard? You can see at the very top, the most effective strategy is to eliminate the hazard, get rid of it. You might say, well, I've got an aggressive bull, call that bull. That's eliminating a hazard. It's harder to do with injected pharmaceuticals that are a need in livestock. So I'm not gonna say we should end our vaccine regimens because we want to eliminate the hazard of needle sticks. That's not really a feasible option. But substitution may be. So as we continue to develop less toxic biologicals, inventories of killed vaccines increase. Maybe if we continue to get better substitutes for things like Micotil that are a very high occupational risk, you can substitute and replace the hazardous thing, right, the toxic biological, with a less toxic option. At the next level are engineering controls, and these are also pretty effective. Things like a roll bar on a tractor is a really, really good engineering control, right? It is built into a piece of equipment and it keeps an operator safe. But we can think about these in terms of animal handling and needle sticks as well. So handling facilities go into those engineering controls, good animal restraint, a good chute that works for your needs. And then also the needle design. So those short or self-tenting needles that allow for a one-handed injection is a good engineering control that will isolate you from the hazard of the needle stick, right? It's built into the equipment or the device that you're using. At the next level are administrative controls, and that means changing how people work. So how do we set up workflows and work systems that are safer? We're getting down to the bottom of the triangle, which means they're becoming less and less effective. And the reason is people don't always do what you want them to. We all know that, neither do animals. So in this context, we have lots of unpredictable behaviors. But thinking about a training program for employees about good technique for injections, good technique for animal handling. I talk to a lot of farmers who, particularly those with cattle, and it's always interesting to hear from them the care that they put into who do they hire and how do they train workers to interact with cattle. That keeps the workers safe and also doesn't get the cattle all wound up every time they're trying to do something. So training about just good animal handling basics is also an administrative control that could reduce the risk of a needle stick injury. In addition to those techniques for injections, etc. At the very bottom of the hierarchy of controls are PPE, personal protective equipment, tends to be the least effective, in part because you have to rely on people to use it. There really aren't a lot of PPE options for needle stick prevention. You could tell people to wear gloves, but if you've ever tried to give a subcutaneous injection with a pair of leather gloves on, you've just added a lot of extra time to your workflow, likely. So it's hard to think through really what PPE would even necessarily be appropriate that would specifically reduce the risk of needlestick injuries. So in any, this is a useful thing to think through the hierarchy of controls. It's straightforward, generally makes sense to people, and you can apply it to your own operation, and think about how in any part of your workflow or work processes, what can you eliminate? What can you substitute for something else that's ideal? How can you re-engineer your systems, or, engineering controls also include guarding on equipment and things like that, right? How does your equipment operate? And then also those workflow protocols, training, and then finally having PPE available for tasks that it is beneficial. And that's my last slide. I think we're right at a half an hour. And I'm happy to take any questions. I'll stop sharing so that Bill can get his slides set up. But if you have any questions, I'm happy to take them.
Does anybody have any questions for Brandi? I am not seeing any, no worries. If you do think of any, feel free to put them in the chat, or if you have any afterwards, we can definitely get you Brandi's email if you didn't catch it from the last slide that she had, and that way you can message her with those questions that you have. Brandi, thank you for such a wonderful presentation, and we look forward to hopefully having you back for some other presentations in the future. You're more than welcome to stay on if anybody has any other questions, but thank you again so much for everything today.
Thank you. Y'all have a good day.
Our second presentation of today is by Bill DeMoss, who is the owner of Mountain Vet Supply in Fort Collins. His presentation today is making the most of your herd health dollars, and we will look forward to this presentation here. Bill, you are ready to take it away whenever you are.
While Bill and Brittany are working on technical difficulties, I thought I would just add a couple of notes for everybody out there watching. One reminder, if you haven't put your information into the chat box about your safety group policy name and number, or not the number, excuse me, but your name and your company name, please do so we can apply your credits for this policy period. I did want to mention that we will be sending it out in CLA Weekly this Saturday, but the guidelines document that was developed off of the video that we produced after the animal handling trainings that we held last June at both a dairy and a feed yard. The video is published on our website. There's a video in English and in Spanish. It's not too long. It's not over 20 minutes, so it's a fairly short video. That is on our website, and now the guidelines, the guidance document in both English and Spanish is available on the website as well. So it's under the safety tab on the CLA website. We're also going to highlight it in CLA Weekly, and we'll share it out on social media. It's also available on your CLA member portal under the resources tab. So for those of you who have logged in and created your CLA member portal, you can find safety resources and other resources for your membership under the resources tab on the left-hand side. And if you have any questions about using that portal, we would love to help you access it. Brittany is the lead on the CLA member portal, and she has been working for weeks trying to get it all figured out and get all of the bells and whistles working for everybody. We think it's going to be an awesome tool to just further engage with the membership and provide more resources to everyone in kind of a members only access setting. So if you have any questions on that, please reach out to Brittany or myself, and we'll make sure you're getting everything you can get from that.
Can I add one thing?
Yes, thank you.
Sure.
I was running out of things to say.
I was just doing some Googling after Mary's question about needing to be incinerated. Certainly in Iowa, and I'm also not finding anything that I just put the link in the chat. I don't know if everybody can see that, but if you go to the Colorado Department of Public Health and Environment on their medication and sharps take back program, there are some kiosks that you can dispose of sharps containers, but they do have guidance for proper trash disposal, and there's no indication that it needs to be incinerated. A little more Googling suggested that really only needles used in like chemotherapy applications or radiation treatments are typically incinerated, that they can be put in the regular trash. So, but don't put it in your recycling bin, right? Don't put your laundry jug that you've repurposed into the recycler, put it in the trash. It can go out with the regular trash. So that's
Thank you.
follow up on that.
Thank you so much. That's perfect. I did want to also mention that Pinnacle Assurance, they launched their new learning management system, which is sort of a replacement for the old JJ Keller online webinar system. So for people who aren't able to join a safety group meeting, hey, we have some action here. Let me just finish this up. So for people who aren't able to do a CLA safety group meeting, you can always do a session, online session through Pinnacle Assurance, and they have a whole new system now that I think is much more user-friendly for policyholders. But something we're very excited about is that video that we produced over the that Jane got the grant for from High Cause. The 2 videos in English and Spanish for animal handling, those will be on Pinnacle's learning management system. We're not sure when they'll be available. I'm hoping for the next policy period for many of you. So as soon as we get information about that, we will get it out to everybody. So with that, it looks like we have some progress on Bill's presentation.
My presentation today is mainly about just making the most of the money you spend on herd health products. They're not getting cheaper by any stretch. So I've got some main points that I'd like to go over with you about vaccine handling and storage, routes of administration. So a basic overview of common vaccines and antibiotics. And the VCPR, that's something that's become very important this year with some federal rule changes back in June. So we'll get started with first off is safe storage. These products on a cost per pound basis are pretty expensive. So storage is absolutely critical, not only to maintain the quality of the product, to make sure that the product only goes where the product needs to be, to avoid theft, to avoid accidental exposure. Lock storage is a necessity. As Brandi alluded to, there are some of these, or she mentioned in her presentation, some of these products are inherently hazardous and they need to be kept away from unauthorized individuals. So they need to be in locked storage. They do have a dollar value. There is theft that goes on. You hate to think of that, but it needs to be accounted for. One number that you need to have in your cell phone, it should be in your vet room next to your chute. Accessible to everybody is the number for Rocky Mountain Poison Control, 1-800-222-1222. And that would be one of your primary go-tos in the event of an accidental exposure. In terms of storage, vaccines especially can be fragile. They're biological compounds designed to provoke an active immune response in target animals. And in their best condition, they're only 95% effective in the best of circumstances. Results vary depending on the vaccine, depending on the animal it's being used on. So if you handle that vaccine properly, it only increases the likelihood of better results from that vaccine. And Brandi alluded to in her presentation that there are some products that require heightened safe handling procedures. Those products would be Micotil especially. Micotil is not used as widely as it used to be. Most of the time now it's used in a much more controlled environment in large feedlots. We don't recommend that it be used on the ranch or out in the pen, or where the employee has to handle that product and take it to the animal. It's best that it be used in a in a very controlled, well-designed veterinary processing area. It's an inherently dangerous compound. And there are here in the last decade, the industry has developed, not to knock Elanco or anything, but they've developed better products that are much safer. RB51 vaccine is a concern. It can cause undulant fever in humans. Usually that's used by the veterinarian. Anthrax vaccines, they're virulent, but they're live culture and can cause problems in human health. Pesticides generally are an allergy risk. Most of the pesticides we use now around livestock are not heavily concentrated. The ones that are will require an EPA registration, and you'll have to have a private applicator's training and card in order to even purchase them. The prostaglandins, as Brandi said, they are a concern in pregnant women, and they can also in women in general, because they can cause dysmenorrhea, and which is can be a very uncomfortable condition. Anyone who is susceptible to asthma, prostaglandins are very irritating. They act as a vasodilator. They can trigger an asthma attack, even not only from injection, but from dermal exposure on the skin. So those are the ones that you want to be very safe in handling. And then we have the corticosteroids, dexamethasone, which can also cause spontaneous abortion. Predef 2X is a product that is no longer on the market, so we really don't worry about it as much. Let's see. When we talk, and Brandi did a wonderful job talking about this, so I'm going to go through this very quickly as regarding safe handling procedures. Avoiding needle sticks, limit your exposure. All sharp objects kept on a flat, stable surface, not in pockets, bibs, or teeth. Keep a direct, uninterrupted line between the cooler, vet box, and the chute. Use your sharps containers. Replace needles frequently to avoid unnecessary force. And then probably it'd be a good idea that all of your employees have a current tetanus vaccination. Most of the products that you run through a syringe are relatively not inherently harmful, but what is on the needle when you get stuck can be harmful. When you're looking at all the clostridial bacteria, E. coli's, Pasteurellas that are endemic around livestock, those are things you certainly do not want in your body if you can avoid it. But one at the top of the list is tetanus. In all instances, animals should be properly restrained using the correct chute size, head restraint, use nose tongs if necessary. Instructions chute side in the event of an emergency, knowing the number of the local urgent care and the Rocky Mountain Poison Control Center. The other thing that you can do in the event of accidental exposure, don't be afraid to call your supplier. We'll get calls. Fortunately, not very often, but we do get calls from people who've had an exposure. We've had calls from emergency room docs, and we'll refer them to the manufacturer. All of the major manufacturers have RNs or nurse practitioners on call who deal specifically with accidental exposures to veterinary compounds. Proper restraint's a good thing. These two are not necessarily really good examples of that. Being able to control that animal as much as possible from 360 degrees is going to pay in the long run. It's worth 10 times what you're going to spend on a decent shoot and a decent lead up. Hitting the vaccine types, they kind of fall into two main main groups: the modified live virus, which is a freeze-dried cake and a diluent. It's easily identified because you'll have two bottles. It has to be mixed. The active ingredient is held in a state of suspended animation through freeze drying. Once it's rehydrated, it reanimates and then can go ahead and replicate within the animal. Real important part about the modified live viruses is they must be able to replicate once they go into once they're injected into the subject animal. So they have to be handled correctly. There's the amount of virus particle in that modified live virus vaccine is very low because it's expected to grow geometrically once it goes into the animal. Whereas with the inactivated viruses, the virus particles are suspended in an oil or water solution. All of the virus that animal is going to be exposed to is in that dose of vaccine that you give them. So there's thousands of times more virus particles in a dose of a killed vaccine or an inactivated vaccine than what you'll find in a modified live. Those are the viruses. Those are the respiratory viruses. Then we move on to more common vaccine formulations. You'll recognize these: the Clostridial bacterins and toxoids. Those are the 7-way and 8-way blacklegs. Some will be combined with tetanus. Some will be combined with Haemophilus somnus or red water, which is Clostridium hemolytica. It all varies by geographical region. The main components in the virus is going to be IBR, BVD, parainfluenza, and BRSV. And they may be combined with a respiratory bacterium like a Pasteurella. And then we have other respiratory bacterial vaccines, which are generally combinations of Mannheimia or Pasteurella bacterial pneumonia vaccines. We'll also combine them with reproductive vaccines, such as lepto and vibrio. That's fairly common vaccine combined with viruses given to cows at preg check. Scour vaccines, depending on local conditions, that may contain E. coli, rotavirus, and coronavirus. And then we have our minor vaccines, which are very situational, like pink eye, foot rot, trick, anthrax, and mycoplasma. And I'll brush through really quickly the common equine vaccines we find in Colorado. When you hear somebody talk about a 2-way vaccine, it's specifically a respiratory vaccine. A 3-way vaccine will be sleeping sickness and tetanus. And then a 5-way vaccine is one that combines both of those classes of vaccine for a total package, along with West Nile virus for protection there. And then there's some other minor ones, such as Strangles vaccine. There is a rattlesnake vaccine for to minimize the effects of a rattlesnake strike. And then here in northern Colorado, one that's become fairly common is rabies because of the incidence of terrestrial rabies along the Front Range. Our routes of administration, you should be familiar with these: sub-Q, IM, oral vaccines, like some of like calf guard would be an example of that, intranasal vaccines. And then there are also some subcutaneous IBR pink eye vaccines that are in use. And this slide shows the administrative routes and essentially how you can kind of control those with the angle of the needle. You can control them with the angle of the needle and the length of the needle. Sometimes in giving a subcutaneous vaccine, if you adjust the angle of the needle and the length of the needle, you can avoid tinting and avoid the risk of putting a dose of vaccine in your left thumb. And injection sites, I'm sure most of you have been through at some point a BQA training. where we're trying to limit our injection sites in front of the shoulder and causing as little tissue damage as possible. This shows the common equine injection sites. I always put this slide in here. These are vaccines that went intramuscularly and should have been subcutaneous. Every vaccine has an adjuvant in it. An adjuvant is a compound that's designed to cause irritation at the injection site. And what the reason it does that is so that it triggers the immune system or gives the immune system a message that there's something there that doesn't belong there. And that's the start. Irritation is the start of the immune reaction. Well, you want that immune response to begin in that subcutaneous space right below the skin, because there's really no valuable tissue to be damaged there. When you go intramuscularly with a sub-Q injection, it's still going to get the irritation, but it's going to get it in the muscle where it's going to be more uncomfortable to the animal, but then also you are actually damaging your end product. A quick note on vaccine handling. If you think of vaccine as sort of like when you're running corn into the bin, that corn that goes into the bin is never going to be in any better shape than it is the day you put it in the bin. So you want to maintain the quality of it for as long as you can. And vaccines are no different. Vaccines being biological compounds, they can degrade. And the way we prevent that is by refrigerating between 35 degrees and 45 degrees. And this is critical, inside a climate controlled building. If you have a really good refrigerator in an unheated building, you are freezing your vaccine and it ruins it. It amazes me that, we'll put our groceries in the house when we have vaccine that's worth 10 times what is in the food that is in your refrigerator. We put it out in our old refrigerator in an unheated shop. Cold freezing is death to most of these vaccines. Heat is another consideration. I know a lot of people will have a lot of concern about whether a vaccine is warm or not. These vaccines, when they're produced and bottled, they're put into a sterile environment. They can stand a little bit of heat. Over time, it will degrade the proteins in the vaccine and make them useless. But I want to get back to freezing is the real culprit here. If you freeze a Bactrim toxoid, for example, it's kind of like freezing a head of lettuce. It will lose all the integrity of the cellular components. It'll just turn into a protein mush that the animal will not respond to. And in some vaccines, especially those containing E. coli, when they make those vaccines, they try to clean all of the endotoxins out of that E. coli that they can, but they can't clean out all of them. So if you freeze a vaccine, all of the cell wall portions of it are broken up, and that endotoxin's released, you could wind up in a layer of that vaccine bottle, one dose of vaccine that is mostly endotoxin, and that's going to cause you problems. Sunlight, especially on virus vaccines, is bad. You'll notice that most virus vaccines, especially the modified live vaccines, come in a box. The reason being that box is there to prevent sunlight degradation of that freeze-dried virus in that vaccine. So you want to keep these vaccines out of the sun. You'll notice some of your vaccine guns, especially the Allflex guns, have kind of an amber colored barrel on them. That amber color is there to block the UV light from reaching that vaccine that's in the gun. One good practice to use when you're setting your gun down at the table by the chute, keep a rag there just to throw over the top of that vaccine gun to keep the sunlight off of it to prevent degradation of that vaccine. When you clean your syringes, if you're using a viricide like chlorhexidine, you got to really rinse that off because that viricide will inactivate a modified live vaccine. Generally, soap and water and a really good rinsing, dry it off, re-lubricate the seals on it, and you're good to go for the next time. But do it right after you finish. Don't wait until to pull it out of the box the next time you're going to use it. This is another critical component or critical point about modified live vaccines. Once you mix them, they have to be used within 2 hours. There's nothing in that vaccine to feed that virus once it's reactivated. It has to go into a living, breathing animal in order to stay alive and then replicate. If it goes back in the bottle and back in the fridge, it's going to be dead. It's going to be no better than colored water. It'll have no effect, no positive effect after 2 hours. So make sure you buy your vaccines in quantities that you can use as you mix them. If you have to get extra 10-dose bottles, do that. It's a maybe 10% more money to do that, but it's still way cheaper than throwing away vaccine that's not used. Killed vaccines, all of the bottles will say to use them when they're first open. A lot of times that's not practical. The best thing to do in that situation is to use a clean needle each time you draw from that bottle so you don't pollute the bottle. Buy only what you need. Let us store it for you. Read the label. Keep your syringes clean and your needles sharp. One thing that I like that slide that Brandi showed about how the needles get burred. One of the problems with having a burred needle is if you use a needle that's got a burr on the end of it, it's going to draw hair, dirt, skin scurf into that injection site. And that's where you get injection site abscesses. So not only when you have an injection site abscess, not only did you get no benefit from the vaccine, now you've got an active infection that you have to deal with. And as Brandi said, needles are not expensive, 20 cents a piece. And when you're looking at vaccines that can cost $2, $3, $4 per dose, it's worth changing needles. Really quickly, the antibiotics, they're not a management in a bottle. Always remember when handling animals, there is no shot for stress. You've got to, you can't use antibiotics as a substitute for stress in an animal. Handling them calmly and appropriately, that's going to get you, that's as valuable as antibiotics and vaccines easily. Read the label, follow all label directions unless instructed otherwise by your veterinarian. Using any dosage or route of administration or period of treatment outside what it says on the label is what's called extra label drug use, and that can only be designated by your veterinarian. And some drugs are barred from extra label use by federal law. Baytril, enrofloxacin, those have to be used specifically according to label. And then please follow your meat and milk withdrawal times. Here's a slide shows some antibiotic lesions where they really should have gone sub-Q and instead went in the muscle and caused lesions in the final product. Maintain treatment records. Properly maintained records are your only defense in the event of a violative residue complaint. If you ship an animal and they come back and they found a violative residue, the FDA is going to come visit you and they're going to want to see your records. And most of the time, if you've maintained good records, that animal showing that animal was treated according to label and was withheld from the food supply according to label, you'll get a pass. They may attribute that violative residue to that animal being depressed or something along that line. But if you don't have records they're going to be your best buddy for the next 6 months. And it's really not worth it. The most common violative residues come from penicillin, sulfa, and oxytetracycline. I would also add to that banamine or flunixin. And we'll get to that here in a second. Using banamine, and this is one that I harp on, if you use it according to label directions, it's 1 to 2 cc's per 100 pounds, IV use only. If you give banamine sub-Q, it's going to create a lesion underneath the skin that it's going to take at least 60 days for that to go away. I don't know if you can see this, but Merck has kind of helped with that by developing a transdermal banamine formulation that can be used topically. They've also included banamine in with Nuflor and a product called Resflor, which gives it a subcutaneous label. As I said, if you're going to use banamine injection, learn to give an IV. It's not that hard. Your veterinarian can instruct you on that. The withdrawal period on the label is applicable only when it's given intravenously. Here's a couple examples of a horse where they were given sub-Q Flunix or banamine, which then wound up causing cellulitis in the horse. Here's some trim out. You can see at the base of that picture or at the center of that picture, the lesion caused by giving banamine intramuscularly. Lastly, a note on the veterinarian client-patient relationship. To access any prescription medication, you have to have an established VCPR with your veterinarian. We can't sell those products to anyone without a prescription. The value of that, it allows that veterinarian to implement a preventative herd health program, set up protocols for you. That veterinarian is going to be available to you and at times that you need them. And the money you spend building an effective VCPR, it goes far beyond an ounce of prevention beats a pound of cure. Having that veterinarian involved, using those compounds appropriately, because it's not, we've found in this business, it's not just that you use a particular vaccine or a particular antibiotic that makes it economically valuable. It's the timing and the application of that vaccine or that compound.
Bill, we have one question for you.
Yes. Mm-hmm. Yeah.
We have a question of if you could go back to the slide that shows a list of common violative meds such as penicillin.
Mm-hmm. Let's see if I can get back there. Let's see. I'm just going to go back through this. Here we go. Yes.
Here we go. Perfect.
The
Thank
reason
you.
those are most common, those are the most common violative residues, is they're so easy to catch. If a steer goes across the kill floor, and they'll take a petri dish and they'll swab the end of their sheath and get a little bit of urine on that petri dish. And in that petri dish, that petri dish is impregnated with bacteria. And they put that in the incubator, and if those bacteria grow, then odds are, this is just the gateway to it. Then odds are that animal is clean. But if those bacteria don't grow, that animal had something in it that it ought not to have had. And I'll just say one more thing on the VCPR. Are there any other questions?
That is all for right now. Thanks, Bill.
Okay. Lastly, on the VCPR, beginning June 11th of 2023, there are no more over-the-counter food animal antibiotics in the United States. So the only way to access those is through your veterinarian, through a VCPR, where you buy it from the veterinarian or the veterinarian prescribes it through a supplier like us. And if you don't have a VCPR in place now, contact your local veterinarian at a time when they're maybe not so busy. Invite them out to your place, pay for the farm call, sit down with them, go over your protocols, let them know what your operation's about. It will pay off in the long run. And if you have any questions, please don't hesitate to give us a shout. And that's what I have.
Thank you so much, Bill. Does anybody have any further last questions for Bill? I'll let you put them in the chat or the Q&A question box. I'm not seeing any pop up, but don't hesitate to reach out to Bill or also reach out to us if you missed that information on the screen here. We'll be happy to share that information with you so you can contact Bill. Thank you both again so much for joining today, both you, Bill, and Brandi, for speaking today. Wonderful presentations, really informative, and I know our members really appreciate this great information. With that, if you don't have any other questions for us, everybody in attendance, we will adjourn today's webinar. And if you don't have any questions, if you have any questions for us, don't hesitate to reach out at any point. Thanks so much, everyone. Hope you have a great rest of your day and Merry Christmas.